Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Pathology Homeopathy. Today we will look into the important disease, that is Atherosclerotic Cardiovascular Disease, in relation to why young people are dying. So take the example of Puneet Rajkumar or Siddhartha Shukla. These are physically very strong guys and they have very poor health. That is the reason. What is the reason? That is Atherosclerotic Cardiovascular Disease. We will look deep into it. So these guys are physically fit but they have not maintained their cardiac health, and we will look into what are the reasons for cardiac unhealthiness and how to fix that. We will look very deep into it. Atherosclerotic cardiovascular disease means heart is an organ, right? Unlike any other organ, it also require blood supply. To blood supply, it will get nutrients, it will get oxygen, it will get waste materials in and out of the cells, electrolytes, everything. Providing heart with blood is very important. When there is narrowing of this arterial coronary arteries or arteries supply to the heart, so heart will have no blood supply, or we call it ischemia. So that is the reason. So these young people are dying, and the narrowing of arterial wall with the deposition of cholesterol and other things, not only cholesterol, other things, we call it as atherosclerotic cardiovascular disease. So normally we might have heard from our ancestors or our grandfather and grandmother, they will say, my father lived for 100 years. One day in sleep he suddenly peacefully died. So actually this is the disease of aging. One day when you are healthy, finally you have to die with atherosclerotic cardiovascular disease. But what is happening now? This is pushed forward. People are dying within 30s, within 40s. It is too early to die this kind of a disease. So what is making it? Our lifestyle modifications, our food habits, our exercise habits, all these are the reasons for this. We will look deeply into it. 50 years ago, 10 heart attacks. Out of 10, 9 were men. Only 1 was women. Because estrogen is a female hormone. They have this hormone which is protecting them from atherosclerotic diseases. Now the ratio is bit changed. Out of every 10 people, 4 are women and 6 are men. What is the reason for this? So women have started smoking, women have started taking alcohol, women have started taking work and going under stress, and also lack of sleep, lack of proper food, eating rich carbohydrate and saturated food. These are all made them to change the ratio. At least in this, women are trying to catch up men. Then we will look into the symptoms of atherosclerotic cardiovascular disease. Out of 10 people, 6 people will die on the first attack. Important symptom for this is death, and rest of the people will have symptoms like precipitating of this atherosclerotic disease. They will have weakness at that point in time during heart attack, or they feel like vomiting. They will not vomit. Some people vomit at this point in time. Some people have chest pain. The chest pain may be localized or it may be radiating to the left hand. Some people will have giddiness. Some people will have palpitations. Palpitations means, so normally we will not hear our own heartbeat. So in this condition, in this palpitation, they can hear their own heartbeat. For some people, it is just an anxiety. Anxiety around the chest or around the neck or around the abdomen, around the back, anywhere, or they can feel discomfort on chest, neck, back, anywhere in the body. The pain is shooting from left upper limb. Sometimes it is asymptomatic. They will not have any symptoms, but they will have precipitation of ASCVD. Okay, these are the signs. And one more symptom is some people have sweating. Most of the people, 60% of the people encounter death. So why is it precipitating when doing exercise? So during exercise, heart contraction increases, heartbeat increases. The demand for oxygen for the heart muscle increases, the demand for a nutrient, demand for electrolytes, everything increases. When there is a block in the heart supplying artery, so the demand is more, there is no supply. At that, the heart muscle suffers ischemia. Ischemia means lack of oxygen. We land into heart attack. So this is the reason why people are dying in gyms during physical exercise, because it is precipitating at that point in time, as there is more demand for oxygen when we are doing workout. What are the investigations that are to be carried out when you suspect ASCVD? First and foremost investigation is ECG. We call it as electrocardiogram. It will record the electric signals of your heart, and if there is any ischemia, death of the heart muscle or malfunctioning of the heart muscle, we will come to know in ECG. And also we can take the same ECG in treadmill, that we call treadmill ECG. We ask the people to walk briskly or run on the treadmill, and we will take the ECG so that we can check whether exercise is precipitating the heart attack for these people. And one more thing is CT scan. In the CT scan, you can see atherosclerosis only if calcium is deposited. If calcium is not deposited, you are not going to see anything in the CT scan. Next one is 2D echocardiogram. 2D echocardiogram clearly indicates the function of your heart. So how much percent your heart is still functioning. So which chamber is functioning, which chamber is not functioning, you can clearly see in 2D echography. Next one is coronary angiography. Coronary angiography is, you can see the blood vessels of the heart very clearly, and you can also determine how much percentage of the blood vessel is narrow. So that is clearly seen in coronary angiography. Next, lipid profile. Lipid profile is very important. Elevated LDL levels and decreased HDL levels is the indication for ASCVD. So we have to check blood sugars, postprandial blood sugar, random blood sugar, and also fasting blood sugar, so that we will come to know what is the carbohydrate level, or and also we have to check for HbA1c, which will clearly determine whether you have glucose under control for the last 3 months. So all these symptoms which future we are going to see are these because of malfunctioning of glucose metabolism. So this is all due to glucose metabolism and also other things. We will look deep into it. And also you can check for cardiac troponin I and cardiac troponin T. These two are the contractile proteins within heart. Under normal circumstances, when there is no ischemia or death of the heart muscle, they should be in certain level. When their level increases in the blood, it means the person has undergone heart attack. So that is a test for cardiac troponin T and cardiac troponin I. Before we go on to pathology, understand the disease, we have to understand normal structure and functioning of the heart. It is very important. Heart is a hollow muscular organ. It has 4 chambers. Lower left chamber we call it as ventricle. So from the ventricle, big arteries arise. We call it as aorta. So aorta is the main artery that is going to supply blood to entire body. At the starting of aorta, they have a small space that we call as aortic sinus. From aortic sinus, there are 2 blood vessels that are arising. One is left coronary artery on left side and right coronary artery on right side. These left and right coronary arteries further divide and perfuse all the heart. Means these are going to supply blood to the heart. This is the structure of heart. And what is the function? Heart is going to supply oxygenated blood to entire body, and it takes the deoxygenated blood from entire body or entire all the tissues and pushes it to the lungs. Again in the lungs it oxygenated and it is again moved to entire body through aorta. So this is the functioning of heart. Next we will understand lipid metabolism. So lipid metabolism means fat. We are eating fat, right? We have to understand fat. Studying about fat is a ocean, but we will not study all those. You study only the things that are related to ASCVD. First one we have to study is different type of lipids. Lipids are classified into various classes. The first one we have to discuss is simple lipids. Simple lipids, in that we are going to discuss about triglycerides, which is important for cardiovascular disease. Next one is compound lipids. Compound lipids is lipoproteins. We call it as chylomicrons, VLDL, IDL, LDL, and HDL. So these class belongs to lipoproteins or compound lipids. Next one is derived lipid. We have to talk also about the cholesterols or sterols. These comes under derived lipids. So we will take one by one. So first of all, we'll understand the basics. Take some oil and put it on water. So will oil mix with water? No, it will float. In the same way, when you put oil or fat into the blood, what happens is fat is not mixed in the plasma. That's the reason to transport the fat, we need some things that we look later. So we will discuss about triglycerides. Triglycerides are the energy sources. Fat in the form of triglycerides is energy. So some of the triglycerides will decrease the LDL. Some of the triglycerides will increase the LDL. Some of the triglycerides will decrease the HDL. Some of the triglycerides will increase the HDL. Where do we get these triglycerides from? These triglycerides we get either from diet or the liver synthesizes triglycerides from carbohydrate. These are the 2 sources for triglycerides. And we will next look into the part saturated fats. They are also come under triglycerides. Saturated fats are a part of triglycerides. So saturated fats, these contain single bonds in their aliphatic chain. Carbon between carbon, all the carbons will have only single bond. There is no double bond. So this is very important here. When there is increased intake of saturated fats, you will increase the VLDL production. VLDL production, it means indirectly you are increasing LDL. So and also you will decrease the HDL. So this saturated fat will increase LDL and decrease HDL. This is the important thing you have to keep in mind for saturated fat. And next comes the unsaturated fat. In unsaturated fat, we have monounsaturated fat and polyunsaturated fat. In monounsaturated fat, so we have only one double bond in aliphatic chain of fatty acid. So these are monounsaturated fatty acids. These monounsaturated fatty acids, they don't have any effect on LDL or HDL. They will neither increase nor decrease HDL or LDL. You have to be very mindful of this, because we will use we will use all these knowledge to optimize our diet, so you have to be very careful. And next comes the polyunsaturated fat. These will have more than one double bond in their aliphatic chain. The fatty acids which are in polyunsaturated fatty acids will have at least two double bonds. So these are again divided into omega 3, omega 6 and omega 9. We will not discuss about omega 9 because those are not important, but definitely we will discuss about omega 3 and omega 6. Discuss on omega 3 fatty acids. With omega 3 fatty acid, we have to remember this sequence. Omega 3 fatty acid, first precursor is linolenic acid. Linolenic acid is converted into EPA, and EPA is again converted into DHA. So this is the sequence. So these are very important. These are anti-LDL, means they will decrease the LDL. These are pro-HDL, they will increase the HDL, and these are anti-platelet. They will prevent platelets from clotting, and these are anti-inflammatory. So it will decrease the inflammation in your body. So these are very important things to remember. Then comes to omega 6 fatty acids. Omega 6 fatty acids, linolenic acid. So linolenic acid, it is we call it as La. Linolenic acid is converted into AA, arachidonic acid, and arachidonic acid is again converted into PG, means prostaglandins. These prostaglandins are pro-inflammatory. So finally we can say that omega 6 are inflammatory, but they don't have any effect on increasing or decreasing HDL or LDL. Next comes the compound lipids. So we have already discussed fat cannot be dissolved in plasma. So how to transport fat within the blood? So then the body has come up with a specific excellent mechanism. This mechanism we will completely discuss about it. What happens here is the fat is packed, both cholesterol and triglycerides. Where are these coming from? Triglycerides will come from diet or liver synthesizes. When there is excess of carbohydrate, when there is carbohydrate we have ingested, that is converted into cholesterol, and that is converted into triglycerides in the liver. There are 37 steps for this. We will not go into those steps. Finally, the products are cholesterol and triglycerides. Liver also synthesizes this lipoproteins, especially apolipoprotein B. And what this liver does is the liver packs cholesterol and triglycerides into a small vehicle. That small vehicle we call it as VLDL. So on the surface of the VLDL there will be apolipoprotein B. Even the apolipoprotein B will be synthesized by liver and pushed into the blood. So these particles, these VLDL particles, travel into the different places. We will look into it. So the VLDL will interact with HDL. HDL is already produced, HDL is produced, and this VLDL interact with HDL, and HDL will take some of the cholesterol and some of the triglycerides out of this VLDL, and the VLDL is now converted into IDL, so intermediate proteins. Okay, now again this HDL interact with intermediate density lipoproteins, and it will again take some of the cholesterol and again some triglycerides, then it is converted into LDL, low density lipoproteins. So finally the LDL is formed. With what does LDL contain? LDL contain small amount of triglycerides, substantial amount of cholesterol, and on the surface it will have apolipoprotein B. Cholesterol will be synthesized by every organ in the body. Okay, every cell in the body, whatever the cholesterol it wants it can synthesize, but there are few tissues in the body they want more cholesterol. What are those tissues? You take adrenal glands. Adrenal glands want more cholesterol because it has to make adrenaline in hormone, and testes need more cholesterol because it has to make testosterone. In the same way ovaries need more cholesterol, it has to make estrogen and progesterone. And also skin need more cholesterol so that it can convert the cholesterol into vitamin D when exposed into sunlight. So they are preparing suboptimal levels of cholesterol, so they have to get more cholesterol. This is taken up by liver synthesis more cholesterol and transport this cholesterol through LDL particles to ovaries or to testes or to adrenal glands or to skin, so that they can produce the hormones. What happens here we will check, and also apolipoprotein B. So this will go, this apolipoprotein B will go and attach these tissues, and it will provide cholesterol to the required organs. What happens is finally when the cholesterol is deposited into required organs, left with LDL. So this LDL is again taken up by liver and it is recycled. So that is the life cycle of LDL, IDL and VLDL. Before we look into HDL, we have to see chylomicrons. When we eat food, the fat has to be supplied to liver, it has to be supplied to adipose tissue, fat cells, or it has to be supplied to muscles, or it has to be supplied to various other cells in the body. How is this possible? So as a fat doesn't mix in the plasma, there should be some vehicle. The vehicle that is carrying fat from intestine to various parts, various tissues of the body, that we call as chylomicron. Chylomicrons are produced by intestines. They'll pack it with cholesterol. Will not be there. Cholesterol will be very less because cholesterol is not absorbed into the body. Whatever the dietary cholesterol we take, it is going out. Only most of it is triglycerides, very negligible part of cholesterol. Most of the triglycerides the chylomicron contains, and they will transport it to all the tissues, mainly to adipose tissue, muscle tissue and other tissues. So that is a functioning of chylomicrons. Then we will look into HDL, high density lipoprotein. These high density lipoprotein are produced by liver and also intestine. So these two are the sources of HDL. So the main function of high HDL is to remove the cholesterol from VLDL, IDL and LDL. And also if there is any excess of cholesterol deposited anywhere in the body, for example like coronary artery wall, these HDL will clear those fat. That is the reason we have to increase more HDL in our body, that we call as good particle. This is main function is to remove cholesterol from the tissues. Next we move into derived lipids. So the best example of derived lipids is cholesterol. Yeah, cholesterol is synthesized in every cell of the body. Okay, there is no life without cholesterol. So what is the importance of cholesterol? Every cell in our body is fluid, right? It is not rigid, it is fluid. So the fluidity of a cell is given to it by this cholesterol. Why? So the cell membrane, the most of the cell membrane is made up of this cholesterol molecules. So that is the importance of cholesterol. No cholesterol means no life. Every cell is able to create its own cholesterol from the carbohydrate, but there are some organs or tissues that need more cholesterol. One is adrenal glands, two is testes, three is ovaries, and four is skin. To produce vitamin D, estrogen, progesterone, adrenaline, testosterone. So this is the importance of cholesterol. Cholesterol and dietary cholesterol. Dietary cholesterol is not absorbed into the body. So how much cholesterol you take in the diet, it will go in your stool. It will not be absorbed. Only 8% of the population will have capacity to absorb cholesterol, but it is not significant unless you take cholesterol in very large amount. There is no need to worry about it. Okay, into etiology. What is the reason for atherosclerotic cardiovascular disease? First one is hyperlipidemia. When there are elevated LDL particles in the body, or elevated decreased HDL particles in the body, so you will get this disease. And next one is diabetes mellitus. So we have already discussed. So liver converts carbohydrate into triglycerides and cholesterol. So if you take more carbohydrate, which is leading to diabetes mellitus, you will have cardiovascular diseases. Smoking has a very important pathway. When these LDL particles reach the arterial wall, they will engulf the cholesterol within it and undergoes a inflammatory reaction. Thus that inflammatory reaction is increased or precipitated by smoking. So if you smoke, you are more prone to get atherosclerotic cardiovascular diseases. Next one is hypertension. Hypertension is also one of the major reasons, and if you take more carbohydrate in your diet, it will lead into creation of more cholesterol and triglycerides. So that is also reason for cardiovascular disease. And if you take more saturated fats will increase LDL levels and will decrease HDL levels. Bad cholesterol and it will decrease good cholesterol. So stress is also one of the leading cause for atherosclerotic cardiovascular disease. And also omega-3 fatty acids. Omega-3 fatty acids have the capacity to decrease LDL and increase HDL. So if you take less omega-3 fatty acids, it can also lead to cardiovascular disease. Next, we will look into the pathology, how these are formed. We have clearly understood some tissues or some organs need more cholesterol than they can synthesize, even though every cell in our body can synthesize the cholesterol. Adrenaline hormone, adrenal glands to produce adrenaline hormone, it requires more cholesterol. For ovaries to produce estrogen, progesterone, it needs cholesterol, more cholesterol than it can synthesize. And also testis needs more cholesterol to produce testosterone. Even the skin need more cholesterol to produce uh, vitamin D when it is synthesized. So to supply these cholesterols to these parts, liver will synthesize VLDL, which is converted into IDL and which is converted into LDL. So these LDL particles will have a protein on their coat that we call as apolipoprotein B. So this apolipoprotein B normally should be depositing this cholesterol into testis, adrenal gland, or ovaries or skin. What happened is this apolipoprotein B has capacity to attach itself to arterial wall as well. When it attaches to the coronary arteries, so this and deposit the cholesterol over a time, this plaque will increase in size with the deposition of fibrinogen, with the deposition of carbohydrate, with the deposition of calcium. It will increase inside. It will block the complete artery one day. So that is the cause for the death. So the important point to remember here is apolipoprotein B is a culprit here. Apolipoprotein B is present only in VLDL, IDL, and LDL. It is not present in chylomicrons or HDL. That is the reason chylomicrons or HDL are not responsible for heart attack. Only VLDL, LDL, and IDL are responsible for producing erytheromatous plaques because they contain a surface protein, that is apolipoprotein B. It is very important for you to remember. So what is the mechanism? This is the mechanism for pathology. So it will start with small streak in the arterial wall. Over a period of time, it will increase and finally it will block the complete arterial wall and causes the death. That is the pathology for ASCVD. What is the conventional treatment? Conventional treatment means when you suspect you have ASCVD, when you have symptoms of ASCVD, you will go to a doctor who is nearby, or you will go to a corporate hospital, or you go to the cardiologist. So what they normally give is this conventional treatment. So they give statins to reduce the cholesterol, and thrombolytics. They give thrombolytics or anticoagulants so that your blood will not be clotting. So blood thinners they will use. And in case of emergencies, when your coronary arteries or its branches are partially blocked, they will insert a ring-like structure that we call as stenting. So or else they will go with coronary angioplasty. So angioplasty means they will remove part of coronary artery, and they will replace it with healthy artery from your thigh. So that is the thing. And they will also treat with for hypertension and also diabetes mellitus. So all these things, whatever we have discussed till now, will have side effects, will have addiction forming. But homeopathy has better treatment compared to conventional treatment, except in the case of emergency. In case of emergencies, there are good medicines in homeopathy, but we advise you to go for allopathic treatment only in case of emergency. If it is not emergency, then you can treat well with homeopathy. What is the homeopathic treatment in ASCVD? Call it as constitutional treatment. Constitutional treatment means as a person, you have a specific genetic code. A disease caused by two things. Only either it is acquired with your food habits or your lifestyle, anything like that, and also from genetics, which your forefathers have given it to you. It is a combination of both. With these two, there will be three changes. One change in the physical structure. What is the physical structure here? The arterial wall is altered, it is closed, and there will be functional changes. What is the functional change? Your lipid example is your lipid metabolism. Your lipid metabolism is deranged, or your carbohydrate metabolism is deranged. And psychological changes, because of this you will have some psychological stress or psychological fears, whatever it is. So in homeopathy, this constitutional treatment is given based on physiological, psychological changes, uh, which you have got due to acquired or genetic disorders. So when we give such type of medicine, only individualized to you, so that medicine we call it as constitutional medicine, and it is very effective in treating ASCVD. Next, not only the constitutional treatment, we also give local treatment. You have statins in allopathy. Even homeopathy has statins, but our statins are doesn't have any side effects. And also, there are excellent medicines homeopathy which can reduce your insulin resistance. So not only constitutional, but also we have specific treatments for in case of specific patients. Homeopathy doesn't have side effects. Homeopathy is very effective, and homeopathy is very cost effective as well. Why homeopathy doesn't have side effects? The reason is we give homeopathic medicines in very minute quantities. You take allopathy, you take ayurveda, you take siddha, any other system of medicine, they the medicines are given in few grams to few milligrams. But in homeopathy, the medicines we give is only picograms. It is very less compared to any other system of medicine. So, and also homeopathy medicines are not crude medicines. There are some crude medicines like mother tinctures, but mostly the important medicines we give are not crude medicines. These are nanoparticles in which active ingredient is in the middle, surrounded by lactose molecules. On top of it, it is surrounded by silicon. So how are we making these particles? There is a special way or advanced way of making homeopathic medicines. We call it as trituration and succussion. So succussion is also called as froth flotation. For froth flotation, the homeopathic term is succussion. So with trituration, each molecule will have a coat of lactose. With succussion, each molecule will have a coat of silicon around it when it is placed in the silicon container. So this is the structure of homeopathic molecule. So when we give these molecules in very minute quantities, as in the case of picograms,